So we're with the School of Nursing. We are with the JACQUES Initiative for our community health class, and it's just the HIV clinic across the street. And we had to create an intervention. One statistic that we saw was that 30 to 50% of men who have sex with men in Baltimore have HIV, so that was really alarming to us, and we thought, wow, I wonder what's going on. And we saw that they were less likely to get tested, and they were also less likely to be in treatment and stay in treatment. So what we did was we created, we thought a really good education tool for them would be social media. So we created a Facebook, a Twitter, an Instagram, and just put up information about HIV, where to get tested, events going on in Baltimore for men who have sex with men. And then we created this campaign. It's called Put It in Your Mouth. We made business cards and flyers, and we went around out in Mount Vernon to gay bars and clubs, and we were giving it out. And everybody was like, wow, put it in your mouth. That's so funny. That's so cool. Like, what is this all about? So everybody, really liked the campaign. They took our cards, and we ended up getting a lot of traffic on our Facebook page the next day, a couple more likes, and, hopefully just made more people aware about HIV and about how testing is free and where they can go. And so, hopefully we can increase awareness for that community, the men who have sex with men community, and just kind of help educate and social outreach and hopefully bring that statistic down.
We help HIV/AIDS patients with legal issues. We take them on as clients and help them with sort of long-term legal issues. So our referrals come from case managers at Evelyn, Jordan, and JACQUES primarily, or the HIV people who are HIV/AIDS patients will seek us out themselves, but we mainly get them from Evelyn, Jordan, and JACQUES. And then we interview them and see if we can help them with their legal issue long-term. So we do a lot of Social Security work, like helping people with Social Security appeals, disability appeals. We do a lot of work with child custody cases or things like power of attorney, living will, just sort of helping people with longer term legal issues that may prevent them from accessing care or adhering to treatment because they are sort of like psychosocial stressors in their lives that might stop them from adhering to treatment. And if we can alleviate that burden, then hopefully they can adhere to treatment, and we can all sort of work together to make that happen.
Right. And we also do brief advice at JACQUES every Tuesday morning, where we go in and meet with the JACQUES patients and hear about whatever legal issues are going on. And if we can help them, if it's something quick like a medical advance directive, then we can maybe help them on the spot. If it's not, then we either work to take them on as a client or refer them to some other organization who can help them with that issue.
I'm with JACQUES Initiative with Project Shalane, and what we do is we go out into our faith-based organization and educate them on HIV and AIDS, and we try to get them interested in offering the services at their church for the community. We've been successful with many churches, such as Metropolitan Methodist Church, United Methodist Church, Payne Memorial, St. Matthew, and I go to Mount Lebanon Baptist Church. So the second Saturday of every month, we offer free HIV testing to our communities. We do that, supportive counseling, preventative counseling. If someone is positive, we find out they're positive. I've lived with HIV for 16 years, so I try to explain everything to them about the next step, and we walk them through getting to their first appointment with JACQUES Initiative, and making sure that they're comfortable and that they're in the treatment. So that's what we do in our community.
Okay. So why is church a good place to reach people?
Because it's safe. When you think of a church, you think of it being a safe place that you can go when there's no judgment. And a lot of people don't like, with the stigma out there, they don't want to go to certain places that's known for HIV testing. So this is a way that they can be comfortable and ask whatever questions they have without feeling like they have to be a certain way or whatever, non-judgmental, and with love, so with the compassion that's needed.